not sure if it's Jeffren or Jeffrey, is asking about the most common side effects that are associated with bispecific antibodies and what precautions can be taken to reduce the risk of infection.
Yeah. Another great question. There are two different bispecific antibodies that are now approved for relapsed refractory follicular lymphoma. And I will take this time to also say that some of the exciting ongoing work is looking at those agents in clinical trials in the frontline setting in combination with other therapies, particularly non-chemotherapies. In general, I would say similar side effect profile. The most common side effect between them is the cytokine release, or the CRS. So that is the most common side effect. Again, this can be defined in different ways. The most common side effects that you see from that define CRS are fever, hypotension or low blood pressure, hypoxia or low oxygen, shortness of breath, chills, tachycardia or higher heart rate. So we have talked a lot about CRS and what it entails and how it is defined and presents, but management, it depends on what we call grading. So for patients who just who have a fever, oftentimes, number one, you want to make sure that it is CRS and that there's not an underlying cause, so ruling out infection or coexisting infection. If a patient is neutropenic or has a low neutrophil count and is at high risk for infection, you may treat them with antibiotics with the fever while you rule out infection. But oftentimes, if they have a fever, you can manage symptomatically anti-fever medications like Tylenol. If a patient has worsening CRS and has other symptoms associated with it, such as the hypoxia, low oxygen, or hypotension, low blood pressure, then that's when we escalate therapy. So one, you direct treatment towards that. So if they need fluid, if they need oxygen, but then that's when you're thinking about starting medications such as the steroid medication. So we give intravenous dexamethasone, or there's certain cytokine blockers such as tocilizumab that can be given to help treat the side effects of the cytokine release. Other common side effects or that we're seeing in more patients in the clinical trials, fatigue, rash, and then infections, including upper respiratory infections, and then COVID-19 infection as well. So part of treatment of these side effects is early recognition of the side effects. So patients are monitored closely and that you're dealing with the side effects to help them from worsening. I think infection prevention is very important with these. So it's recommended to consider prophylaxis for certain infections. So antiviral medication to prevent viral, such as shingles reactivation, medication to prevent a specific type of pneumonia, PJP pneumonia. And then consideration, I think, of just making sure that patients are up to date on vaccination. And if patients do have infection while they're getting treated, potentially delaying treatment or taking a break in order for them to recover from treatment.